Earlier this year, I heard a radio interview that sort of kept me parked and listening in my car. It was about donut theory. Donut theory is an economic vision for sustainable human well-being. And well, I'm already sort of pro donut, so my ears perked up, and I like sustainability. And it came to me in this time of reckoning, kind of racial reckoning, uh, commemorative and memorializing and recognition of Juneteenth for the first time in our nation's history, and recently of the Tulsa Greenwood community and all that was lost there. And I really felt that those people would have appreciated the metaphor of the donut and could really hold that meaning. Those striving to create beloved community and sweet life, um, to innovate, to address safety and well-being in case of emergency, those rooted in self-determination and seeking quality healthcare delivery. So, innovating to address safety and well-being in case of emergency and before, long included in the vision of uh, places like the Freedmen's Hospital, established in response to um, the need to provide access to care that could be relied on by Black providers, including peer supports and uh, neighbors, helping neighbors. And there's also a birthing care workforce and infrastructure that was community-based, created for the community, by the community, capitalized by the community, and attended nearly all Black births prior to the medicalization of birthing. And then there's the Freedom House ambulance service that pioneered a professional EMT role and reduced the role that law enforcement held in medical response. Each of these were instrumental in supporting the uh, uh, healthcare system, training healthcare providers, and bolstering protective economic fortunes, pioneering and embracing innovations used to this day. And this is important because Freedom House innovated this response to routine mistreatment, and they served as medical advocates and escorts for improving healthcare interactions. And we know that this is important because Black baby survival is enhanced when Black doctors are available to them, and they become available through workforce development. Undoing systemic maltreatment reflected in other systems in addition to the medical system and striving for improvement is stressful. So, let's understand that constant striving has a cost. So let's get everyone up onto the donut, fill in the gap, and learn from these historical perspectives, these innovators in the area of emergency, urgent, and maternal care. We can find ways that crisis care is rare, that holes and margins and gaps don't threaten our communities. Thank you for listening.